So hi, good evening everyone. And before I actually get started, a quick thumbs up or a yes in the chat box if I'm audible and the visuals are also okay. Good evening, Yogesh. Good evening. Krishan Pal, good evening. Good evening. All right. All right. Thank you so much. Okay, that's so we have good evening, Krishan. Good evening, Simriti. All right. Thank you. Good evening, Dr. Sudhakar. All right, so thanks for the confirmation. So now we are good to go. So let's get actually started. Happy Doctor's Day. Thank you so much, Dr. Radhesham. Happy Doctor's Day to everybody. So hope you're having a good day. All right. Happy Doctor's Day, Pankaj. A very, very happy Doctor's Day to everybody over here. And may you go on and become really, really wonderful and great doctors, right? So, and you get what you're aspiring towards. Manali. Good evening, Manali. Okay. Yes, thank you, Anand. Happy Doctor's Day to you too. Good evening, Brajesh. All right. Shalo, let's get started with today's class. And this is going to be a random, I'm going to take up the questions from pharmacology. So before this, what we used to do, good evening, Brajesh, good evening, Deepak. Before this, what we used to do, we used to take up specific, topics and then MCQs around that. But now because this is a quick revision class, so this is going to be randomly from all over the pharmacology. Again, so as I always say, that keep the chat box buzzing, attempt as much as you can, and we'll be doing quick revision of topics also around this. But it will be very quick, fast paced as compared to before. So before I actually head on to the actual questions, these are some few necessary announcements from the Unacademy platform. So they have a NEET PG Vital, which is a comprehensive recorded videos. And what you get here is that 800 plus hours of recorded lectures from more than 19 subjects, and it has been really in a very concise manner and very targeted manner from all the top faculties of the country. Now, comprises of all your needs, which is your clinical based questions, your image based questions, the PYQs. So you can subscribe to this by going to the Unacademy platform. Then the next one announcement is about the batch, which is for the ACE next batch 23 or NEET PG 24, whichever you are aspiring to, write whichever exam. And these are very focused batches, and it is started from June 21st, and again it will have classes, 200 plus classes with 400 plus hours of revisions, and it will be covered in a period of 6 months, and this is actually applicable. You can get access to that for rupees 6,000. The last announcement is for the ones who are appearing for the July 30th FMGE examination. So this will be a very rapid, quick revision batch for those students because it is targeted only very high yield. You can say the questions and the topics, which is 100 plus hours, and you get live mentorship alongside. And this you get at a very throwaway or a very competitive price of rupees 2,999. Again, you can go to the Unacademy site and avail this offers. To whoever find that whatever offer suits you, you can just go ahead and make the best use of it. All right, with this note, let's get started with the first question of the day. So which of the following parameter is used to assess the rate of absorption? So all this I have already taken up before, but I'm revising it. So let's see how much you can recall from the previous sessions. Which of the following parameter is used to assess the rate of absorption, whether it is Tmax, Cmax, half-life or area under curve? Okay, Smriti says 4, Akshit says 4, okay, Satish says 4, Krishpa says 4. Okay. रेट की बात कर रही हूँ. I'm talking about the rate of absorption. So please be very sure. Do not confuse. Rate of absorption. So all of you are telling me 4. but this is not the correct answer. ठीक है, rate is not area under curve. Area under curve tells you the extent of absorption. ठीक है, this area, ये पूरा area, if you see, what it tells you कि कितना absorption, how much has the absorption been there. So it tells you about the extent of absorption. Rate is how fast the absorption is occurring, how fast it has reached this Cmax. Yes, doctor, yes, Krishnpal and Dr. Radhe Sham. So yes, Pankaj. So it is the Tmax. Okay, remember, T is how fast, kitna jaldi absorption hua hai. That is the Tmax. How fast the Cmax has been attained. That is Tmax. So it tells you about the rate of absorption. Area is always big. Area bada hota hai na, it's very big. So it tells you kitna absorb hua hai, how much has been absorbed. So remember, area is about the extent and Tmax is about the rate. Fast होती है ना, T से train is very fast, so it tells you the rate of absorption, कितनी fast, ठीक है. So rate of absorption. Area is धीरे धीरे, slow. Big area, extent. So this is the, so please जिन्होंने 4 आंसर किया था, kindly rectify and just revise again and correct this, ठीक है. I hope you will not make this mistake now in the final exams. चलो. Now this one, the another graph we have, which of the following statement is correct? Now see the graph and tell me which of the statement is correct out of the 4 statements. First statement is drug C is least potent. Second statement is drug A is most potent. Third statement is drug B is more potent but less efficacious than drug A. The fourth statement is B and C are equally efficacious, but B is more potent than C. Alright, let me see the responses. Most of you are giving me the response as 2. And yes, very good. This is the correct answer. Drug A is most potent. ठीक है? 3 कैसे होएगा? 3 will not be the answer. So let's go from 1 to 4. Drug C is least potent. Cannot be, because least potent is drug D. So if you go towards right, potency will decrease. Okay? If you go towards left, potency will increase. Okay? Potency will increase. So left side potency increase, right side potency decrease. So LP increases, RP you can say decreases. So C cannot be the least potent because D is still towards the right. So therefore D will be most potent. So this is not the correct answer. Let's see the third one first. Drug B is more potent but less efficacious. Yes. Drug B is more potent but less efficacious than A. So let's compare A and B. Efficacy is always your height. जितनी ज़्यादा height उतनी ज़्यादा efficacy. ठीक है? उतना ज़्यादा effect, उतना ज़्यादा. So B is more efficacious. So ये less efficacious कह रहा है. So this is the wrong answer. More potent भी नहीं है because A is more towards the less. So A is more potent, but definitely B is more efficacious. So this is a wrong statement. Yes, अगर C, अगर the answer would have been C is most efficacious, then it would be the correct answer. But C is यहाँ पे दिया least potent. Last में B and C are equally efficacious, बिल्कुल भी नहीं, because C is at a higher level. It is more effective as compared to B. So higher you go, more effective you become. पता है rank wise अगर आप जाते हो, like if you go from lower rank to higher rank, the more ranking you get, the more effective you are. आपके उतने जो आपके commands है, they'll become more effective. So higher you go, more effective you are. So height is equal to your effectiveness. So efficacy is depending on the height. Potency depends whether left or right. So LP, एक ही चीज याद रखो, LP increased. So left side potency increased. So right automatically decrease. So ultimately the correct option is drug A because it is the most towards the left. So this will be the correct. So this is the most potent. Right? So this is, remember. Okay? Awesome. So the second option is the correct answer here. Sure. Let's go to the third one now. Antiglaucoma drug. anti-glaucoma drug which acts by increasing the uveoscleral outflow via ciliary muscle is? ठीक है? Alright, let me see. Pankaj says 2. 2 is brinzolamide. Okay. Smriti says 3. Latanoprost. Krishnapal says 3. Sanjeev says 3. 3. Akshat 3. C. 3. C. Excellent. All of you almost are on the correct thing. So it is your latanoprost, which increases the uveoscleral outflow, and that too by which increases the uveoscleral outflow. These are prostaglandin F2 alpha analogs, right? So let's quickly just revise the mechanisms. में भी बात करें, the drugs which increase the uveoscleral outflow, as we already discussed here, these are your prostaglandins F2 alpha agonists. So here you have your latanoprost, bimatoprost, etc. All these drugs, those prosts are there. Increase in the trabecular outflow. So can you tell me which drug increases the trabecular outflow? Trabecular outflow. Trabecular outflow is increased by, yes, very good. One is pilocarpine. Okay. Then physostigmine, and the new drug netarsudil. ठीक है, जो रो काइनेज इनहिबिटर है, please remember this, it is a ro kinase inhibitor, new drug asked in an exam. So netarsudil, so pilocarpine, physostigmine, netarsudil, so they all increase the trabecular outflow. Last wala hai the drug which decrease your aqueous formation. So aqueous formation, what all drugs decrease? Remember A, B, C, D. ठीक है, A, B, C, D. A, drugs like apraclonidine. A is drugs like apraclonidine. B is your beta blockers. B is your beta blockers. C, beta blockers कौन से हैं? Timolol, bitoxolol. Okay. C is carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors like acetazolamide, brinzolamide, dorzolamide, all those drugs. D is, you can say, remember, diuretics which are osmotic like mannitol. ठीक है, and dipivefrin. Dipivefrin. ठीक है, dipivefrin. So these are the drugs which increase the decrease the aqueous formation. So remember the mnemonic A, B, C, D. So isme the another question which was recently asked was that a patient of glaucoma also has asthma. ठीक है, if also has asthma, so which of the drugs will you not prefer to give in such patients? So अगर इसमें से आता है A, B, C, D में से, like especially they were referring to your beta blockers. So one of the beta blockers was in the options. So which beta blocker? Yes, very good. Timolol should not be given. ठीक है, Timolol should not be given especially because Timolol is a non-selective blocker. ठीक है ना? So in any case, beta blockers should not be given in a patient of asthma as such, because it can, go into the systemic circulation even less, but through the nasolacrimal duct, and it can enter in systemic circulation and aggravate asthma. So they should not be given in the patient of asthma. Yes, beta blockers not to be given. Another important thing, you should know about their side effects. What are the important side effects of these drugs? So please go through all the side effects. Like latanoprost के side effects very commonly asked. ठीक है? So what are the prostaglandin F2 analog side effects? Like brown discoloration of the iris, heterochromia iridis, then overgrowth of the eyelashes, then macular edema. These are very, very common side effects which are asked in the exams. Okay. Sure. Next one. Calculate the therapeutic index from the graph below. So this is a calculation. Can you calculate the therapeutic index from this particular graph? This is very important. Therapeutic index has been asked time and again. Very good, Sahil. It is 8. Excellent. So the correct answer is 8. So how you calculate therapeutic index? The formula is, very good, Andrews. It is tile. Remember the mnemonic tile, which is therapeutic index equals to the lethal dose in 50% of the population, or the toxic dose in 50% as divided by the effective dose. Okay, so इसमें LD50 you see here in the 50%, the one which is 64, and here if you see it is 8. So the answer would be 8. Yes, LD50 over ED50. So whether it is your toxic, lethal is actually always in case of animals when you're doing, we do the lethal doses. But if we are talking about the human population, which we cannot take the lethal dose there, so that is the toxic doses. So that is, so either it is asked the formula or they can ask you to calculate. So whichever way, therapeutic index, remember this. And this is what is the actual graph of the therapeutic index. Whether it can be even TD50 over ED50. It's the same. Even if this is the option, then you can mark this also. Urine seizures, buffering. Wait a sec. Stuck. Is it okay now? All right. Chalo. Good. Yes, please. Atropine, excellent. All right. It is atropine, excellent, because all these are actually signs of cholinergic poisoning. So for cholinergic poisoning, your antidote would be atropine. Okay? Atropine. That is the correct answer here. Okay, okay. Maybe I think there were two different connections, so I've now put them on the same connection. All right. Let's discuss important antidotes very very quickly. ठीक है, फटाफट आंसर आने चाहिए इसके लिए. Organophosphate carbamate, which is the antidote? Oximes पहले नहीं कभी लिखेंगे, ठीक है? We will first write atropine. And I asked you, carbamate साथ में पूछा है, so therefore oximes do not work with carbamates. So अगर only organophosphate, then we write oximes, ठीक है? This is not for carbamates. Remember, if it is carbamate poisoning, then you will not give. Or atropine hamesha would be the first thing that you do, and then you give oximes. Never oximes first and then atropine. Chalo. The second one, the Datura, belladonna, atropine. Chahe whatever poisoning is asked, it is the same. Whether they ask you the Datura, whether they ask you belladonna, whether they ask you atropine. Very good. It is physostigmine. Physostigmine. Excellent. Digoxin. Very good, all of you. Krishan Pal, Satish, Samriti, Sahil. Excellent. Digoxin. Very good. Digibind. Very good. This is Digibind or Digifab. ठीक है, Digibind or Digifab that you can use. Beta blockers. Excellent. Beta blockers. Very good. Glucagon. Glucagon. ठीक है, beta blockers, glucagon. Benzodiazepines. It's okay, Smriti. Glucagon. Benzodiazepines. Very good. Flumazenil. Excellent. Flumazenil. Morphine. Very good. Morphine. Flumazenil. Excellent. All of you are absolutely correct. Yes, naloxone. IV. Naloxone. Shabash. Excellent. Okay. Methanol or ethylene glycol poisoning. Ethanol. Yes, ethanol. One is ethanol. What is the other one? Very good. It is fomepizole. Fomepizole. ठीक है? TCS. Tricyclic antidepressants or salicylates. Tricyclic antidepressants or salicylates. Very good. Sodium. Excellent. Sodium bicarbonate. Sodium bicarbonate. Last one, paracetamol. Ammonium chloride nahi beta. Ammonium chloride we give it in poisoning with basic drugs. Very good. N-acetylcysteine. N-acetylcysteine. Excellent, all of you. So these are there are more too, but these are very often asked antidotes for the drug poisonings. So this is a table that you cannot skip. ठीक है, for the exams. Must know है ये. ठीक है? चलो. Let's get to the next one now. All right. So another very commonly asked graph. Identify the type of antagonism. Identify, I'm not giving you the options here, I just have to tell me the answer. Identify the type of antagonism. This is a line Weaver-Burke plot, okay? Very good, Simriti. It is non-competitive. Excellent, Sahil. It is non-competitive. Okay? Excellent, all of you, great. So non-competitive, V-shaped, almost looks like a V-shaped graph. Agar competitive आएगा, so I'll show you these three graphs. Okay? So this is a non-competitive inhibition that I gave you. V-shaped. Competitive is very good. Competitive is like a X. Okay? Competition है. खूब competition है like an X. Very good. Shabash. And uncompetitive starts with a U. So graph with little, it looks like a U. Okay? Yes. So competitive, again, ये भी important है. Km increases, Vmax remains unaffected. And if you talk about non-competitive, Km is unaffected, Vmax is reduced. ठीक है? And uncompetitive में दोनों reduce हो जाते हैं. So ये दोनों चीजें, these you should know. ठीक है? More competition, more kilometer. Yes, more competition, more kilometer. तो less competition है नहीं, so you're not running anywhere. ठीक है? So ये remember the shapes. So that is how you remember. So ये काफी बार they ask you. So this is a quick revision of this. All right. Next one. Let's go to dose at which the dopamine acts on the beta-1 receptor. Less than 2 micrograms per kg per minute, 2 to 10 micrograms per kg per minute, 10 to 20 micrograms per kg per minute, या more than 20 micrograms per kg per minute. Simriti, okay, says 2. Krishnapal says 2. Sahil says B. Krishna says A. 2, 2. Very good. All of you have, maximum of you have given me the correct option. This is the medium dose, you can say. Okay, the medium dose पे dopamine acts on the beta-1 receptor. ठीक है? So ये हमारा correct response है. So जो low dose है, low dose पे it acts on the dopamine receptor. Medium dose पे it acts on the beta-1 receptor. So more than 10, it will act on the alpha receptors, causing the vasoconstriction. So this is your inotropic effect basically, and this leads to renal vasodilatation, increases the urine flow. ठीक है, डोपामीन, यस डोपामीन है. और जो ये मोर देन 10 we only use we don't use if let's say we are using in the patients of CHF, so we'll not go beyond this dose. Yes, more than 10 alpha, so we don't go beyond this dose. In shock, if you require high rise in the blood pressure, then you can only go beyond this dose. Otherwise, the dose is less. And what is the major difference between the two similar sounding drugs, dopamine and dobutamine? So can you tell me on what receptor does dobutamine act? Dobutamine. Dobutamine. Very good. It is beta 1 only. It has no effect on the dopamine receptor. No effect. Okay, so don't get confused. Dopamine has dopa in it, so it will act on the dopamine receptor. Dobutamine doesn't have dopa in it, it will not act on the receptor. Yes, beta 1 receptor only. So it also is an inotropic effect, but no effect like the dopamine one. Yes, excellent. Very good. Sure, next. So a 20-year-old male visits a center to quit tobacco, which he has been consuming for quite some time. So which of the following drug can be prescribed to him? Simriti says 4. Okay, very good. 4. Shabash. Great. Awesome, all of you. So this is a drug which is the one of the drugs given for smoking cessation. Other drugs? What are the other drugs that can be given for smoking cessation? So very nicotine pro. Mnemonic is very nicotine pro. So very is very good. Varenicline. ठीक है? Then we give nicotine patch or gum. Gum. Pro is bupropion. ठीक है? Yes. So these are the 3 drugs you should remember. Very nicotine pro is the mnemonic. So very varenicline, nicotine and pro is bupropion. So इसके साथ confusion हो सकती है. Another drug which sounds very similar is buspirone. Can you tell me what is buspirone? What is buspirone? What is it? Buspirone. Very 5-HT1 agonist. Excellent. It is a 5-HT1 agonist and it is an anti-anxiety drug. G-pyrone, ipsapyrone, okay? So they are anti-anxiety drug. Excellent. Very good. All right. Sure. Now this is the diagram. Has been asked again. I will just enlarge this a little bit. You have to tell me which drug acts on site 1. I will enlarge it a little bit. And if it is site 1 पे, so ये है site 1. Which drug acts on site 1? ठीक है, ये site 2, this is site 2, this is site 3, this is site 4, this is site 5. So these are antimicrobials. Which antimicrobial acts on site 1? This one. No, not cyclosporin. You're close. Before cyclosporin. No, bacitracin is site 3. Cephalosporins, beta-lactam, site 5. Very good, Simriti. Bingo. It is phosphomycin. Okay, it is phosphomycin. Good evening, Dr. Metroid. Good evening. So let's do the different. इसको हम open करते हैं now. Let's study this one. So this is the actual. ठीक है. So ये this is the actual graph and let's see what are the various drugs which are acting at this site. So drug 1 site पे it is your phosphomycin, second is cycloserine, third is bacitracin, fourth is vancomycin, and the fifth one is your beta-lactamase. All your beta-lactamase, penicillin, cephalosporins and all, they act here. Good evening, Dr. Neha. ठीक है. So एक how to remember actually this one. So you can remember, see, simple story. First we buy a cycle, बाद में van, जैसे जैसे we start earning money, and then we go to Land Rover, then we can buy Land Rover. ठीक है. First cycle, उसके बाद में van and then Land Rover. So first is your phosphomycin. ठीक है. First is phosphomycin, then cycloserine, third is bacitracin, V is vancomycin, and land is lactamase, beta lactamases, oh sorry, beta lactams here. So ये एक serial, in series you remember because they ask you the steps, whether they go from 5 to 1 or 1 to 5. So this is from inside to outside. ठीक है. So first, this is very important. Just this diagram is important because I can ask you any other site. So remember, first is phosphomycin, cycloserine, पहले first cycle, बाद में van and then Land Rover. Remember this simple mnemonic. Out of these, another things which are important too, yeah, that is firmly bind to bacterial cell wall. You can also do, but will this tell you the chronology 1 2 3 4 5? Because उसमें bind पहले आता है ना, तो C बाद में आता है. This I am telling you in chronology, step 1 2 3 4 5. If you remember firmly bind to bacterial cell wall, it will tell you the names definitely, but वो order में नहीं आएगा 1 2 3 4 5. So this I am telling you how to remember in order. So first step, second step, third step, fourth step, and fifth step. This you can remember this way. Alright. So इसमें जो phosphomycin है, the only utility of the drug is it is used for UTI now. There's no other utility of this drug. ठीक है. हाँ, that is only for cell wall. अगर आपको, you need to know the names. But this is chronology because that is how they ask you stepwise. So this is to help you in stepwise manner. Cycloserine, it is now currently used as a part of MDR tuberculosis. No, not much use is there. ठीक है. And phosphomycin mainly for UTI. Bacitracin also, it is very nephrotoxic. Very toxic. Not much used, only in carriers. Staphylococci carriers में इसको use करते हैं. What is more important are your vancomycin and beta lactams. ठीक है. Vancomycin and beta lactams. Yes. So vancomycin is definitely the drug of choice for MRSA. ठीक है. It is the drug of choice for MRSA. Yes. Another important thing about vancomycin you should know, it is the side effect, which is the red man syndrome. ठीक है. Red man syndrome, which is seen because of vancomycin as it releases a lot of histamine. When you give it very fast, then it should not give it very fast. It's slowly then actually if you give it very fast, it causes the release of histamine and it leads to red man syndrome because the patient develops redness all over it, mainly in the trunk area and the face and the neck. So all those rashes are there. And how can you prevent it or how can you treat it? Prevention is if you give it slowly, and initially you can also give an antihistamine before you are starting this infusion. Slow infusion, give an antihistamine. And if you give it slowly enough, so very less cases of vancomycin can be, this red band syndrome can be seen. So this is very important. तीसरी चीज है, this is a very highly nephrotoxic drug. So should not be combined with any other nephrotoxic drug like aminoglycosides. It needs dose reduction in renal insufficiency. So if there is any other nephrotoxic drug which is being given alongside, we cannot combine them with this. ठीक है. So beta lactams, so it is a whole, what all you should know, the penicillin, the cephalosporins, about the carbapenems. So all they come under beta lactams because they inhibit the enzyme here, that is transpeptidase. Okay, so transpeptidase inhibit karte hain and inhibit the formation of cell wall, and all of these are cidal drugs. Okay, cidal drugs. So ye tha overall about this particular diagram. Chalo, let's go to the next one now. RA treatment. Let's do these are the drugs. Okay. So RA है patient को and he developed blurring of vision, corneal opacity. ठीक है, very good. ये दो चीजें हैं जहाँ पे where there is eye involvement. It is mostly because of chloroquine toxicity. ठीक है, chloroquine toxicity leads to this. And what is the other picture they can show you is bullseye. Yes, bullseye retinopathy. Bullseye retinopathy. High loading dose. Why do we give high loading dose with chloroquine? Yes, Hemant. Why do we give high loading dose? Because chloroquine has a very, very large, very good volume of distribution. Very large volume of distribution. It gets sequestered in the liver and also in the eye. So that has a very large. And drug of choice for a demand of choice. For rheumatoid arthritis is your methotrexate. Okay? Yes, almost. So demand of choice for rheumatoid arthritis is methotrexate. Acute cases में it's only the anti-inflammatory drugs that will be requiring your NSAIDs and the corticosteroids, but they will not take care of the pathology. They will only take care of the inflammation. If you have to take care of the pathology, we require the disease modifying drugs. The problem with these disease modifying drugs is that they are not very quick to act. They take a time. They take some time to show their effect. That's why they call us even they are slow substances. So they are biological agents and non-biological agents. So biological agents are all your interleukin 1 antagonists. ठीक है, वो सारे TNF जो alpha के antagonists, all your biologicals, you call them biological agents. The non-biological agents, so are these drugs like methotrexate, chloroquine, leflunomide, sulfasalazine, hydroxychloroquine. So these are your drugs. Gold. ठीक है, ये सारे आपके non-biological agents हैं. तो इनमें से yeah, they actually it got rescheduled and somehow I think it wasn't updated. Yeah, it got there was some issue that day. It couldn't be held. It was not there, Autometroid. But I think the information didn't reach. Okay. So let's do this one. Now, methotrexate is the demand of choice for, as I said, for rheumatoid arthritis. ठीक है, ये आप याद रखना. It is the choice. Chalo, the next one, please. Let's go to the next one. Therapeutic effect of levodopa is abolished by. Therapeutic effect of levodopa is abolished by. Number 2, pyridoxine. Yes. B6. Excellent. It is B. Pyridoxine, which is vitamin B6. So, vitamin B6 should not be given with levodopa. And why do you think it abolishes the therapeutic effect of levodopa? Because vitamin B6 is going to a cofactor in the enzyme dopa decarboxylase, which is going to metabolize levodopa into dopamine in the periphery. ठीक है. So therefore it is not given or recommended to be given along with levodopa. ठीक है. So we give levodopa usually along with carbidopa. So if we are giving levodopa along with carbidopa, then we need not worry about this because already carbidopa is inhibiting the enzyme dopa decarboxylase. But this interaction is more of value if there is alone levodopa being given. But currently we don't give levodopa alone, we are always combine it with the carbidopa. So in that case this will not hold that much significance because already dopa decarboxylase is being inhibited. Okay? And so just related to this is vitamin B6 should be given with a drug which is INH. Okay? INH के साथ we prefer to give this vitamin B6 because of the side effect of INH, which is your N stands for neuropathy. Yes, INH or isoniazid, which is causing the neuropathy. Okay, so therefore we should give pyridoxine. We should give prophylactically pyridoxine 10 milligrams per day. And otherwise, अगर हमें already peripheral neuropathy, we have to give therapeutic doses also of this alongside. Okay, so isoniazid causes N with nephropathy and H is hepatotoxicity. These are two major side effects with INH. Yes. All right. Chalo. Next one, please. Clostridium difficile diarrhea is most commonly associated with doxylamine. You mean morning sickness? It is doxylamine plus vitamin B6. B6 देते हैं with doxylamine. ठीक है? We give vitamin B6 with doxylamine. चलो, next is Clostridium difficile diarrhea is most commonly associated with 3 aminopenicillins, okay, 2 all right. So most commonly associated Clostridium difficile is actually aminopenicillin. Zyada common is aminopenicillin. Yeah, penicillins. It can also be seen with third generation cephalosporins. ठीक है? And अगर वो उसमें आएगा, if there is an option of third generation cephalosporins, then you will mark them. ठीक है? So if it is not, then you mark aminopenicillins. ठीक है? Amoxicillin, ampicillin like drugs. That is what. But ज़्यादातर it is with third generation cephalosporins. Okay, so all these cephalosporins and then followed by aminopenicillins. Okay, so what is the treatment of Clostridium difficile? What is the treatment for Clostridium difficile? Yes, drug of choice for Clostridium difficile. Vanco? No, currently not the drug of choice. Pseudomembranous enterocolitis. Yes, yes. Very good. It is now fidaxomicin. Fidaxomicin. इसके relapses are much less. ठीक है? So currently this one is preferred as a drug of choice which has much less relapses. If not responding or if recurrent हो रहा है बाद में, then we can give vancomycin or metronidazole. ठीक है? Yeah, but answer of a question आएगा, you have to write this. This is the currently the scheme. ठीक है? All right. So which of the next? Okay, which of the following does not require reduction in renal failure? Which of the following does not require reduction in the renal failure? Three, that is doxycycline. Doxy C3, yes. So all of you are almost correct. Yes, it is there in India. I think someone was asking. Yes, it is there in India. So which of the following does not require doxycycline? Remember, this is the only tetracycline which is safe in renal failure. Tetracyclines are unsafe in renal failure. Only tetracycline which can be used in renal failure is your doxycycline. Okay? Or what else is important here to know is which are the antimicrobials which are safe in the renal disease. Okay? These are the list of antimicrobials which are safer in the renal disease. कौन सी है? Ceftriaxone, cefoperazone, tigecycline, rifampicin, erythromycin, ampicillin, clindamycin, doxycycline. So these are comparatively safer in the renal diseases. Tetracyclines में I said you can remember bus only doxy is the drug which is safe in renal disease. All the tetracyclines are otherwise not safe. Another thing about tetracycline, I would like to know that expired tetracycline. What does expired tetracycline lead to? अगर expired tetracycline है, what does it cause? It causes mnemonic बनाई नहीं है, मैं सोचती हूँ उसके लिए. ठीक है, let me see, search for this. There are so many others. These are few antimicrobials which are safe. Very good. Fanconi's anemia. Fanconi's, yes. ठीक है, so this is because of the expired tetracycline or syndrome rather, right? It is syndrome. And एक और जो important इसका side effect है tetracycline का, yellow discoloration of teeth. These are two important side effects seen with tetracyclines. Yellow discoloration of the teeth and then Fanconi's anemia. ये दो important side effects हैं tetracyclines के. ठीक है, और एक और भी है which is seen with demeclocycline. Syndrome, I think syndrome is a better word to use. Fanconi syndrome, because it's nephropathy and all this also there, so you can use Fanconi syndrome. Demeclocycline. Spelling. Demeclocycline, it can cause phototoxicity and precipitate, or it can cause even diabetes insipidus. A few important drawbacks, or you can say these are the side effects, very important side effects to know about tetracyclines. Okay, yellow discoloration, expired, can lead to Fanconi syndrome, and demeclocycline, phototoxicity and diabetes insipidus. ये कुछ important points है about tetracycline groups. ठीक है, alright. Sure. Shifting gear towards CVS. Drug of choice for digoxin-induced ventricular arrhythmia is. Drug of choice for digoxin-induced ventricular arrhythmia is. Simriti says 1, okay. Dr. Matroy says 1. Andrew says 1. A, very good. All of you are absolutely on point. It is lignocaine. Okay, very important. Digoxin is a very, very important topic. Very, very important topic. ठीक है, lignocaine. तो ज़रा quickly हम इसके few important points let's just go through. So you know that this is a drug which has a very narrow therapeutic index. ठीक है, और therapeutic range. So we do therapeutic drug monitoring for such drugs, digoxin. And if you give more than if the levels is more than 2 nanograms per ml, that is leading to the toxic effects. So toxic effects come. Though you cannot actually say that if the levels are below this, there will be no toxicity, because its levels sometimes are not the correct, they can say they don't give you the correct sort of levels where you cannot depend on predicting the toxicity. So the levels may be less, but still the toxicity can occur. So that is because there are various other factors also involved in the toxicity, whether it's your the electrolytes जो present है body में कम है ज़्यादा है, they can also lead to the toxicity. So only levels we cannot predict. We have to monitor the patient and see the actual things. Okay? So only level will not be there. Now let's do the earliest and the most common side effect with digoxin. Earliest, and these are the non-cardiovascular. Earliest and the most common side effect with digoxin, what is it? It is nausea and vomiting. The non-cardiac wala. ठीक है? Very good. Nausea, vomiting. Most common and the earliest. GI. The most common arrhythmia. Which is seen with digoxin. Most common arrhythmia which is seen with digoxin. It is ventricular bigeminy. ठीक है? Yes, ventricular bigeminy, ventricular arrhythmias. Vision defect, which is seen with digoxin. Vision defect that is seen with digoxin is very good. Yellow vision, yeah, xanthopsia. You call it yellow vision or you call it xanthopsia. It is the yellow vision. Okay? So treatment wise, if we talk about the treatment, xanthopsia. If it is a ventricular arrhythmia, okay? If it is a ventricular arrhythmia, your treatment is lignocaine. If it is atrial arrhythmia, then your treatment becomes, because you want to inhibit the impulses from atria to the ventricle, so you have to give a drug which will act on the AV node. Okay? AV node. No. So the drugs which can inhibit or which can cause the conduction, delay in the conduction. कौन से हमारे हैं main drugs? We can give you beta blocker. Beta blockers, ठीक है? CCBs, beta blockers here. So we prefer, we can give beta blockers. Then AV block है. Let's say digoxin has caused a AV block. Then what will you give? Adenosine is the drug of choice for PSVT. But agar it is digoxin induced arrhythmia atrial, then the drug of choice is your beta blockers. Yes, it is for supraventricular arrhythmias. AV block hai? No, beta blocker will increase the AV block. Beta blockers will increase the AV block. Very good. Atropine. Atropine is a drug of choice for bradycardia, or you cannot give a beta blocker for an AV block because beta blockers increase the AV block. Okay? They cause bradycardia, they increase the block. So do not give for that. Atropine is going to act on the muscarinic receptors, and cholinergic जो होता है system that causes decrease, and जो उल्टा है anticholinergic will cause the increase. So atropine is a drug of choice for any kind of AV block or bradycardia. You prefer to give atropine. And as we have discussed before, if it is a severe toxicity, then what do you give? You give a drug like Digibind or Digifab. ठीक है? अगर severe toxicity है, you give a drug like Digibind or Digifab. And then what is the role of electrolytes? इसमें electrolytes का क्या role है? If there is hypokalemia increase करेगी toxicity, decrease करेगी. Hypokalemia. Hypokalemia, hypomagnesemia, very good, or hypercalcemia. They will all increase the toxicity. ठीक है? They will all increase the toxicity. ठीक है? Good. All right, sure. Let's go to the next diagram here, and what you're supposed to say here in this is which drug acts at step 3 in the life cycle of a virus, okay, as shown below. So step 3, I will just tell you which is step 3 is this one. ठीक है, step 3 पे कौन act करता है? So you are saying raltegravir, ठीक है? So integrase inhibitors, basically they're asking you integrase inhibitors, that is raltegravir. Very good. ठीक है? So ये diagram also is important, and various drugs acting at various points you should be able to know. So this is raltegravir. So what are the drugs which act at the entry level? ठीक है, entry level में attachment में fusion inhibitors, or the ones which inhibit the attachment. So we have drugs like maraviroc, and then we have enfervitide. ठीक है, ये actually attachment के यहाँ पे maraviroc, enfervitide, they are used there. Then this drugs like tenofovir, zidovudine, ठीक है, abacavir, yes, abacavir, lamivudine, all these drugs, these are your reverse transcriptase inhibitors. Reverse transcriptase inhibitors. Nevirapine, ठीक है, all these are your reverse trans, so they will act at the step number 2. So step number 3 is all your integrase inhibitors, and then step number 4 यहाँ पे, ठीक है, and step number 5 and step number budding increase जो ही करती है, यहाँ पे ये सारे important है. So protease inhibitors कौन सी आएंगी? Protease inhibitors. So all जैसे आपके protease inhibitors है ritonavir, ठीक है, ritonavir, ठीक है, atazanavir, darunavir, ये सारे protease inhibitors हैं. And ritonavir, you know, it is an enzyme inhibitor, one of the most potent enzyme inhibitor, and it is given along with the other navirs, and that is called as the boosted PI regime. ठीक है, boosted PI regime है when you give ritonavir with the other navirs, because it increases their levels, because it's a very potent enzyme inhibitor. ठीक है, so this is important point, which one is given. And then you can give the these are the important drugs. और ये जो diagram है, it was shown in the previous exam, and they had similarly, it's not the same diagram, but somewhat like this was the same diagram, and they had again shown these pointers. वहाँ पे protease inhibitors पूछा गया था, so I just changed the question to this one. But similarly you have to remember, जैसे मैंने कहा, for every diagram for mechanism, whether it's your anti-TB drug, they have asked you about that also. They show you the wall and the targets are shown, and then they ask you which anti-TB acts on what target. So ये जितने भी हमने diagrams किए, please remember them and practice them, because this is how they will ask you. Cell wall का किया था, then protein synthesis का भी आ सकता है. They can ask you that which of the drugs acts on the 30S पे कौन करती है, 50S पे कौन करती है. So this is what is important, because when I talk about the mechanisms, they are very important. So do that, practice also. So give yourself a practice question or practice test by this. After you've done the classification, well and good, but sometimes don't get confused if they show you a picture. It is just a classification. You only have to concentrate a little bit and the answers will be clear to you. So it's not all that difficult, okay? So do not get confused when they show you a picture instead of these letters or these words, basically, drugs. All right. So let's go to an easier section now. It's an easier question. Which of the following is available as a transdermal drug patch? Okay, which of the following is available as a transdermal drug patch? Again, transdermal patches are often asked, so therefore I put this question. Transdermal patch. 1, 1, very good. 3 meclizine, okay, 1, 1, 1. Most of you are correct. It is actually not 3. Meclizine nahi available as a patch. It is diphenhydramine. ठीक है, diphenhydramine is available as a patch. किसके लिए? Can you tell me what is the indication? What is the indication? Very good. Yes, okay. It is motion sickness. Just a second. So it is motion sickness. And what is the other patch which is available for motion sickness apart from diphenhydramine? No, not to quit smoking. It is motion sickness. We'll talk about all the other patches also in a while. Just about this. Yes, antihistamines. So यहाँ पे, yes, very good. And the second one, what we give is, very good. It is scopolamine. So we are talking about the patches, scopolamine or hyoscine and diphenhydramine. ये दोनों चीजें, they are available as patches. So quickly हम थोड़े से और patches करते हैं, which are important. ठीक है. So I have given the indication here. So you will tell me the drug patch. ठीक है. So let's do it that way. Indication is given. Tell me the patch available. Motion sickness ka I will fill here only. We have done scopolamine and diphenhydramine. Alright, first one, excellent, it is rotigotine for Parkinsonism. Excellent. Yes, it is rotigotine. Second one, Alzheimer's ke liye. Which drug is available as a patch? Yes, it is rivastigmine. Excellent. Rivastigmine. Smoking cessation. Simple. Very good, Hemant. Nicotine patch. ठीक है? No, nicotine patch. Smoking cessation is nicotine patch. Yes. For pain relief, let's say analgesic अगर है, yes, nicotine patch. Pain relief के लिए, let's say analgesic patch available है. No, not diclofenac. Opioid है, opioid. Okay. Fentanyl is available as, yes, fentanyl is available as a patch. Angina. Let's talk about angina. Morphine. Angina, yes. For angina, chronic angina. Because अगर आप acute है, then you give sublingual. You cannot wait for a patch. Very good. It is nitrates or nitroglycerin patch. So only for chronic, ठीक है? Not for acute attack. Acute attack में हम sublingual action चाहिए. Cannot wait for a patch. Hypertension के लिए, can anybody tell me? Hypertension के लिए? Any patch that you know of? Very good, Simriti. It is clonidine. Yes, it is clonidine, not atenolol. Clonidine. Hormone replacement therapy, we have patches of estrogens, progesterone. Okay, so these are available as patches. Yes, estradiol, estrogen, progesterone patches are available. So these are the important patches, and what are the indications for these patches? Right? Okay. So इसको थोड़ा कम करें, and let's get to the next question. Tell me the drug of choice for absence seizures now. Drug of choice for absence seizures. Ethosuximide. Okay. All of you are giving me one answer. Very good, Learning Hub. It is not ethosuximide, it is valproic acid. So, agar mostly they may not give you both the drugs in the same option. I deliberately put these drugs together because let's say what you will choose. It is agar aise hota hai, so you should choose valproic acid over ethosuximide. Because we prefer to give valproic acid unless until it is a child who is less than 2 years of age. वहाँ पे we cannot give valproic acid, there we give ethosuximide, but otherwise overall you mentioned sodium valproate or valproic acid as a drug of choice for absence seizures. ठीक है? Yes, in children we give ethosuximide, otherwise we are preferring valproic acid only as this. So therefore write this. So carbamazepine is a drug of choice where? Where do you give carbamazepine as a drug of choice? Yes, drug of choice in where is carbamazepine a drug of? Which type of seizures? Very good, partial seizures. Yes, partial seizures, focal seizures. Carbamazepine is the drug of choice. And even very good in the trigeminal neuralgia. It is also a drug of choice in the trigeminal neuralgia. Phenytoin, kidhar, where do we use phenytoin? Generalized tonic-clonic seizures. Excellent, generalized tonic-clonic seizures. So, 2 or 3 more things about यहाँ पे anti-epileptics. Again, it is a very very important topic. Anti-epileptic drugs. ठीक है? So, what is the drug of choice for infantile spasms? Infantile spasms. Drug of choice for infantile spasms. Very good. It is ACTH. And if it is with tuberous sclerosis, then it is vigabatrin. Okay? Yes, vigabatrin. That is another important thing to know. Drug of choice for status epilepticus. Drug of choice for status epilepticus. Status epilepticus. Yes, it is lorazepam. 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 ठीक है? Drug of choice for status epilepticus is lorazepam. So, which anti-epileptics are safer in pregnancy? Either it is lamotrigine or is levetiracetam. ठीक है? Levetiracetam or lamotrigine, they are safer in pregnancy. ये है some of the important features of the drugs of choice in pregnancy. ठीक है? So बाकी all the other types, myoclonic, atonic, all you can write sodium valproate as a drug of choice in all these others seizures, right? Sure. Yes. Now, forced alkaline diuresis is effective in the management of. Forced alkaline diuresis is effective in the management of poisoning by which of the following agents? One is phenobarbital. Okay, yes, excellent. So, ठीक है? So, alkaline जो भी हैं drugs, For febrile seizures, you give diazepam. Febrile seizures, drug of choice is diazepam by the rectal route. Okay, febrile seizures you give diazepam by the rectal route. Forced alkaline diuresis, phenobarbital. So that means अगर acidic drugs हैं तो alkaline चीज देनी है, alkaline poisoning है तो acidic drug देना है. And that is how the rule goes. So इसके लिए what you should know, which are the various acidic drugs and which are the various alkaline drugs. Acidic, alkaline. ठीक है. So acidic drugs जैसे हमने किया पहले भी, we had aspirin, so tricyclic antidepressants था, phenobarbital, right? Phenobarbital, phenytoin. So these are all your acidic drugs, and for the management of poisoning, how you diuresis कैसे करोगे? By giving sodium bicarbonate. So that is called as alkaline diuresis. Alkaline drugs or basic drugs basically. Okay, they all usually finish with -ene. So it can be morphine, atropine, amphetamine. Yes. दूसरा इसमें अलग से और cocaine. It is not this, but cocaine. ठीक है. And there's one drug which is not finishing with -ene but still an alkaline drug. It is your diazepam. ठीक है. So ये आपकी acidic है, alkaline है. Basic drugs के लिए you can give vitamin C or ammonium chloride. Vitamin C or ammonium chloride. So you remember, these are the few. You don't have to remember the details of all the other drugs, but ये याद रखो कि acidic drugs sodium bicarbonate, basic drugs you can give ammonium chloride or vitamin C. Ammonium chloride is a little more toxic, so vitamin C is definitely preferred, but that's the way, whatever option is given. Then एक और चीज I would tell you that, let's say there's a poisoning and you want to see whether you can perform dialysis or not. So dialysis is not effective. Not effective. Can you tell me where dialysis is not effective? Avoid, remember the mnemonic of avoid dialysis. Yes, कहाँ पे? कौन सी drugs I am talking about? Dialysis is not effective in, yes, D is for digoxin. 1D is digoxin. ठीक है. 1D is benzodiazepines. PPB, I couldn't understand what is that. PPB. A is amphetamines. Oh, you mean plasma protein binding. So drugs which have large plasma protein binding, definitely they cannot be removed by dialysis. That is definitely correct. V stands for verapamil. So I'm giving you the examples of drugs where your dialysis will not be effective. So they can ask you, in which of the following drug poisonings will dialysis will not be effective, or kahan pe dialysis, maybe they ask you the other way. So that is how they give it. Okay. So O is for opioids. I is for imipramine, the antidepressant. ठीक है. So antidepressant. So यहाँ पे ये है dialysis. So remember this mnemonic. Alright. So ये mnemonic will make you just learn this and examples. बस ये है MCQ में they will ask you. You can answer by this where you should not do the dialysis. So this was all about today's session, and I think yes, I have come to the end of it. And ये कुछ rapid questions थे regarding all the possible most important other topics, and I have another session I think on 7th, and in that also I'll be discussing few more questions which is very, very important for the upcoming examination. And we're taking up different questions from all over the pharmacology and revise even more. So the basic aim here is just to recall and revise. If you could recall well, well and good. If you could not, go back and revise and see where you're lacking, or jahan pe what point do you feel that this is something that you that's a weak point. So go on and improve on that particular topic. So all these figures and all these what do you call, the tables, they are very, very, very important, very highly, they are must know actually. That's why I've included them, because otherwise there is so much more. But ye to must know hai, that you cannot go to the examination hall without knowing them. All right, chalo. Thank you so much, Dr. Metroid. And yes, so let's sign off for today, and I'll see you next time. And be prepared and keep on preparing. And let's have another quiz. I think it's on 7th now, so we'll have that. Okay, Simriti, thank you so much. Thank you, everyone. Thank you, Dr. Nissi. Thank you. Thank you, Krishnapal. Thank you so much. Thank you, Andrews. Thank you. See you.